Ready?
Yep. Hey, it's Dr. Mike here. This is another Testopel today. We got a lot of them, little pinch and burns. We make a little wheel. And like we talked about, we fan it out so we can put a lot of pellets in different areas so they don't bunch up or extrude. Good. Do you feel me touching you? No.
Just a little tap, that's it.
Mm-hmm. So we just make a little poke there. These testosterone pellets are so good for hormone replacement. They change people's lives. Just gotta get them in the right spot. Good. Okay, so now I'm going to take my pellets. So you're going to come and just hold them right here. Perfect. So the key is to not to drop any pellets. So I do 5 pellets in each spot. So again, this guy's skin is just a little tight. So you're just gonna make that hole just a little bit bigger there. And now you're gonna see that I'll be able to go back in much easier this time. Okay, I'll take the pellets again. And this will allow these people to not need to put gels on or inject themselves for 4 to 6 months at a time. So if you imagine a 2-minute procedure makes it so you don't have to worry about giving yourself medication for months and months and months. So to me, it makes sense. And we are done. And now we just hold a little pressure. We get rid of our sharps, and that's how you put these little pellets in, testosterone pellets.